All right. How about we go ahead and get started? I know we're standing between you and the final champagne toast. All right. How's everybody this afternoon? I see a lot of purple. Awesome. So thank you for joining us on our last session of the day, last session of the conference, and thank you guys for definitely making the trek out. It certainly is always so invigorating for us to get a chance to hear the things that are happening out there in your facilities, the initiatives that you're working on, and having an opportunity to then share likewise with some of the things that are happening in our world. And so today we're going to talk about specifically this tenet of the operating system for the patient experience, which has been shared throughout kind of this conference. And in particular, we're going to talk about seamless interoperability and what that means, why it's important, and within the context of Cerner in particular. So this is actually, I've debated, if you were in the Epic session this morning, I did not share this story. I've actually debated whether to share it. Everybody has a story. But interoperability is actually an incredible passion of mine because of my story. So it's been a while now, but I remember me and my husband were going to have a baby. We were super excited. It's the first time we were kind of getting through that first cycle. We were actually at the GetWellNetwork holiday party where we're like, all right, we've made it through the first trimester. Let's tell people. We told everybody. It was super exciting. Our family, we told our family. The next day, I ended up in the emergency room. Learned we were going to lose the baby. The next day, we moved into our new house that we had bought because we were going to have a baby. Monday, I called the doctor. Said, we've lost the baby. I need to come in. I went in. The physician came in to talk to me. He's like, hey, how you doing? Are you super excited you made it through the first trimester? Tears. Absolute lost it. Now, this was in the same exact hospital, 4 floors up. Same facility, from the emergency room, up 4 floors to my physician. They didn't know. Even though I had called that morning and shared that news, that this is why we were coming in, walked in to celebrate, and we were not celebrating. So this concept of interoperability, of sharing data between systems, of being able to actually know me as a patient, know what is happening to me in the care setting, is incredibly poignant and personal for me. So as we talk about this, there are so many points of interconnection. And being in the healthcare space, in healthcare IT, I understood. I knew why. But it didn't matter. Because that was about what I was going through in that moment. And so, as we talk about all these different touch points and these opportunities to actually be able to have seamless interoperability and the share of information, it's not just about the data and the exchange of data, but it's about the meaningful exchange of information. And as you step outside of the acute care setting, those touch points grow exponentially. And there are so many different ways, so many different places where this information now needs to flow. And it's not just about the clinical system. It's about all of these other things that we talked about, the social determinants of care, all of these other aspects of what's going on in that person's life that may impact what they are then doing and how they are participating in their care. You may have heard that we signed a partnership with Cerner. We're actually super excited about that. And so as we go through the information today, we actually are going to focus on these 3 pillars and how we fit within Cerner's 3 core product suites. So Millennium, core clinicals and the foundation of a lot of their systems. CareAware, how many people actually are using CareAware iBus or components? Great, okay. So CareAware, this is really about a lot of the event management and smart room capabilities and being able to kind of plug in these different modules. And then the third pillar for Cerner is what they call their Healthy Life or Healthy Star by the time you get in healthy care for the care navigators, and healthy life from the patient portal and consumer framework perspective. This is many years coming, many meetings back and forth between Kansas City and Washington, D.C. But in the end, we've actually really got a really nice dynamic partnership that covers 3 of our core products. Specifically, Cerner has actually decided to sunset their competing product on our inpatient side. So they are now a reseller of GetWellNetwork. They have also adopted our rounding tool, and including that in their suite, as well as Loop. And Loop has been a really compelling opportunity there to really plug a lot of what we're able to accomplish in reaching out to patients and plugging that into their consumer framework. And so Cerner's vision around a longitudinal care experience and having these touch points all come in to that one plan that they talk about. So within that, also want to talk a little bit about where we are today and where we're going in light of this partnership. So today we actually have a really solid framework. We've integrated extensively with a lot of different of our Cerner accounts, and we have a framework on which to expand and do even more. So today we do a lot of HL7 with the core clinicals side of this, but we also do a lot of API-based integration with systems that are outside of Cerner that might exist elsewhere. We do have, and we are CareWare certified for information around staff assignments, as well as being able to route notifications to staff members. That all exists today. That's out there in the wild and available. And we are also able to embed Loop within the Healthy Life portal. Framework is coming. Portal's available through SAML single sign-on. The landscape in the industry is changing. While most of the integration with a lot of the core clinical systems today is HL7, there has been tremendous adoption of other types of capabilities around, particularly with the advent of the FHIR API, which provides a common nomenclature, if you will, for how systems can share clinical information, as well as this concept of smart apps, which I'm actually going to let Ryan talk to you a little bit about.
So can you give like a raise of hands if you've heard smart apps, the phrase for? Okay. And consumer framework, is that a term people know? Okay. So these are our newest and latest renditions of these kind of great buzzwords in healthcare IT that we get to hear about all the time, and that are going to solve all of our problems. Either that or Bernie Sanders, one of the two. We'll figure out which one happens first. And so in Cerner and in their desire to bring people into the fold and understand kind of their models, they are also pushing towards the future. They want to help bring technology forward. And so one of the things that we found very interesting about the collaboration is there's a lot of things that they want to focus on and they do really well, specifically in systems. And then there's some things kind of specific to inpatient. They said, look at companies like GetWell versus what we're currently doing. They're doing that in an exceptional way that maybe that's not where we want to invest some of our time or resources, and we want to actually use that in other places that we can invite others to build products on top of. And so the idea of Smart on Fire applications is this idea of saying, and there's all these companies that are creating these great suites, how do we bring those back in a way that we can still benefit the workflow as the infrastructure without having to focus on all of the the niche use cases or applications that we just aren't going to go develop. And so as part of this, we are looking into our first iterations of some Smart on Fire apps, both for inpatient and Loop. And we'll talk a little about what that means. But really what this means looking forward is not just a way to tie back in, it's a way to then take that one step further and do intelligence and data-driven workflows that we couldn't do before through some of these current kind of best practices interfaces or HL7 and things that have worked really tried and true, but now we're saying we need to actually take that one more step further. I need to make the workflow not just integrated, but it needs to be seamless, it needs to be enjoyable, and it needs to enhance and augment what I'm supposed to do, not just be as part of my workflow. And so where we start with that today is in education.
So how many of you are actually doing education with Cerner today, with our system? Yeah, so good number. So today, we build an order catalog that represents all the education that can be ordered for the patient, and that can be anywhere from 100 to multiple hundreds of ordables that need to be created. And the value of that is that you can actually embed those into a lot of the other clinical tools that you have, whether it's standardized order sets or interdisciplinary plans of care. I always struggle to say that. You're able to embed this kind of into those clinical workflows and really kind of make those things come to life. The downside is you have this catalog that you have to maintain. You have to build it initially, and then over time, as you want to change things out, you have to kind of have a whole change management policy and review and how that's all going to come to play, and the resources, of course, on the IS side to actually make that happen, and testing and staging and production and change management, all that side of it. But today, this is what it is. We actually, once the order comes over to GetWell, we prompt the patient, engage them to actually complete the education. Once it's completed, we're actually able to respond back to Cerner using results that then capture who was educated, whether there are any specific comprehension questions that were asked. We saw as part of the showcase that we're working with a lot of our vendors. We do actually have some of our clients who actually have created their own comprehension questions that are unique to the education. All of that can actually be captured as discrete data back into Cerner. Similar for medications, we do have a whole medication module where we actually are picking up on the orders that are being, the medications that are being ordered for a patient, showing them what those list of things are, prompting them to actually take their education, complete it, and then we can capture that information back into Cerner. So today, that predominantly is orders, results, and pharmacy orders. What if there was an app for that?
So here is a first kind of mock of our attempt, and actually not attempt, but our ability to actually put something in a smart app. And so this is probably not what we'll ship tomorrow, but what this shows is the ability to say you already have items within your workflow, whether that's in a main navigation or tied into an M page where you're doing certain pieces that just make sense. They're things that you've tied in specifically, and having to go somewhere and do that in a slightly different way, no matter how good it is or how you reduce that click path, may not be optimal. And so what you see is the ability for us to then not only bring that into the native workflow, into the framework that's supported, that burden of support shifts in a big way. Cheryl talked about orders and catalogs and being able to update those things and keep them up to date and build out every individual piece that you want to add. And so we're thinking about this from a perspective of how do we shift that burden onto giving you that full access within a smart app, being able to order education and have that catalog available that's already up to date, that's already getting that streamlined between when you launch out. And then where that actually goes to make a real difference is how do we then say, I don't just have a patient in front of me, I'm actually going to then use this framework to call back in and get additional data that wasn't maybe available on an ORU or a part of the HL7 message, and I'm going to basically inspect the record even more to find out insights that let me then filter what I recommend or what I might do with that patient and help guide that path so it's not trying to tackle the world all at once and say, great, I've got a catalog of the 2,000 movies at Blockbuster and let me walk around aimlessly as I try to figure out which one might be good. But rather than saying, these are the ones we think you should start with, this is what we recommend based off the patient and where they're at, or what they're dealing with, or something that they have that maybe we didn't know up front. And those might be demographics, might be social determinants of health, they might be diagnoses, they might be past medical procedures, and make that process very simple where it doesn't feel like, yeah, I'd like to actually do more involvement in education for my patients, but I don't have the time to kind of go through and handpick all of that one by one, day by day. That becomes a task. And so that's where we're looking at how do we take that framework and then hopefully get some wheels and then look at the next step of how do we then dig back in and actually make it do something that really improves the experience and not just something that's within the workflow.
So this is actually something that we are working on with Cerner today. We have a kind of preliminary proof of concept in the works, and one of the things that our product and dev team are doing is actually working with our customers to kind of look at how this actually would work within your environments. The real value comes into that it's really easy and fast to install something that is a smart app within Millennium, and really move towards kind of eliminating a lot of the build work that goes into it. And so your time to value, your time to actually get up and use this drops significantly. The labor to actually get up and running and delivering education to your patients drops significantly. So instead of it being a 12 to 16 week project, it's now a couple of weeks, 2 weeks maybe, right? And that 2 weeks is not spent on the technology side. It's looking at the content. What content are you including? What are the rules you want to be building into this that might guide some of those recommendations and things like that? And this just is kind of a springboard, right? From there, it's the opportunity to be including a lot of the other types of things that might be relevant for our customers, whether it's rounding insights, particularly things that don't have a natural home within the electronic medical record. So we've kind of followed a twofold integration strategy. One is, to the extent that it makes sense, we actually want to be pushing that data into Cerner. We want that data to be part of the medical record, to be available for kind of the rules and the data analysis that are happening there within Cerner. But it doesn't make sense to do that with every piece of data that we know about the patient. So can we also then look at this from an experience perspective, where we're actually embedding experiences into Millennium, and that becomes part of that seamless interoperability. It's not just about data exchange, but about that experience of shifting between, more fluidly between one application and another, and knowing that under the covers, the data is consistent and they're sharing appropriately, and you're able to do those kinds of things. So let me talk for a minute about Smart Room. So as I mentioned, Cerner is actually in the process of sunsetting their MyStation product in favor of GetWellNetwork's inpatient solution. And as part of that, part of the exercise is how do we bring that more tightly into a lot of the smart room capabilities that Cerner offers today through CareAware, and take advantage of a lot of the capabilities that GetWell already has that we're bringing to the table outside of just Cerner specifically. And so this might be, we've talked about RTLS earlier today. We've talked about the multiple modalities, different ways of interacting with the system, and providing tools that actually give the patient some choice, give them and help empower the patients and the families to actually have a say and be an active participant in what they're doing. It's things as simple as controlling the lighting in the room, or the temperature, or being able to, place an order for something to eat when they're hungry. All of those kind of things actually help them feel more like they're part of something, and they're actually able to take action instead of just kind of have everything happen to them. And so a lot of these capabilities are really kind of important. And one of the ones I really did want to talk about, and we showcased this a little bit earlier as well, if anybody sat in on the MUSC session right before this, they also talked about kind of some of this work. And that is the Care Board. And so this is a communication tool at the bedside that shows up on the TV screen. You can have it persist, or you can have it kind of triggered based on RTLS, somebody walks in the room, or a keystroke, button, number of different ways of keeping it there or not. And the information that's presented on there is really about kind of what information you might want to be sharing on shift change, but also what things are going to be relevant for the patient. This started out as a tool for clinicians, and very quickly the feedback was, actually, our patients want to know that stuff too. What diet order am I on? Who's taking care of me? And, when somebody comes in the room, what's the level of assistance that's going to be needed for this person? All of that information can show there, and it's flexible enough to kind of adjust to accommodate different points of data as those things kind of may change between different units. GetWell Signal builds off of all of that same information and data. And so, one of the other things about GetWell is that when the data comes in centrally, we're actually able to leverage it in a lot of different ways. And so whether it's showing things on the whiteboard, showing things on the care board, showing things outside the room with GetWell Signal, all of it is about facilitating that communication at the point that it's needed. So as I mentioned, there's kind of these two pillars. One is around getting the data in, and one is around these experiences. We've heard a lot about some of these experiences. The Smart App is one path forward. M-Pages in the Cerner world is another way forward. So things like MUSC has recently created these tools to allow a clinician, as they walk in the room, to actually control the patient's TV screen and to cast information onto that screen without having to grab the pillow speaker or a remote or anything else to interact with the TV. It's right there from within their clinical tools. And so that's an example of kind of embedding an experience within Millennium that allows you to, if you're on the patient's chart, automatically launch something. That might be a smart app, it might be an M page. It's keeping that experience and those opportunities for things that may not exist today in Millennium. Same is true for initiating some video conferencing. All of those things kind of speak to that experiential integration. But it's not just about the acute care space. We've talked about this within the context of Millennium. We've talked about it within the smart room. Let's talk about it a little bit more outside of the four walls of the hospital.
Okay, show of hands again. Who has inpatient in their organization but not Loop? Perfect. So you have probably heard a fair amount and have probably walked through and seen GetWell Loop in action. And this is, when we talk about Loop as part of the GetWell brand, it really is one of those products where the alignment in what it's trying to solve really fits in a common place within the patient engagement process that just made a lot of sense. And so it's very easy to see when it comes in, you've got a product that has its own purpose. As a standalone product, it had important pieces of integration that it tried to accomplish. In and without the concept of having inpatient or Rounds Plus or other parts of the GetWell product suite. And so when we think about this from a integration perspective and with Cerner, we had to also come back and say, how do we think about our products and how they interact together on top of the fact of we now have goals for patients that are cross-continuum. It starts before you ever come in for your scheduled colonoscopy. And then while you're in the hospital, you're getting education. And now you're being discharged, and that's being continued on a loop, and education and content and check-ins. That process should all feel like it's under the same organization. It should feel like it's the same process. It shouldn't feel like, oh, this is completely different. Oftentimes, that type of perspective makes it become something as a patient or a consumer or that we don't want to use, or we feel like, oh, this is not, like they don't have all my information, or I'm filling out the same form again. And so what that really ties into is Loop really thinks about its core-centric model into three buckets: enrollment, the patient experience, and the clinical experience. And these become crucial when we talk about how do we bring this, and how did we bring this forth to Cerner and say, this is where this product lies, and it's important to the value, and then also has these kind of co-tangled requirements with what it wants to do with inpatient. And so we had to bring these and think about them in kind of new ways. And so enrollment is how do patients get on Loop? So historically, this is through ADT, through scheduling, through orders, manual enrollment. Sometimes it's through APIs and third-party integrations that we do with other organizations. And this is what really is going to drive that experience to get the right people on these automated care plans. And then the patient experience. How do I make it seem like every other app you use so that when I get an invitation, I can click on it and I'm filling out very small amounts of information to get me started. It doesn't feel like, oh, I've got to create a password. Now there's a password requirement that's 25 characters. Now I've got two-step, and now I'm not using this app. It's off my phone. And then the clinician workflow. How do we say we want to work really hard to surface patients who, one of the main purposes of Loop is to automate that process as much as possible until it no longer needs to be automated and someone needs to intervene. So when that happens, you better believe we don't want the person to miss it. We don't want the people who are involved to not miss an opportunity to improve the patient satisfaction and answer problems that, though maybe as a nervous, pre-op patient is not really warranted to be nervous about, to me it's a big worry. And being able to provide that confidence for someone who's coming in for maybe their first surgery changes that experience before they've ever walked through the doors, and provides that confidence moving in. And then you get excited for me. So what does this mean in the context of Cerner? So Loop aims to do patient engagement in a very unique way. And in some of our early conversations with the Cerner team, they candidly loved Loop and the concept, and they said this is doing so many things that we try to do within different parts of our ecosystem and our applications and for our customers. And so we really wanted to figure out, okay, where do we start? We can't bite off the entire chunk at once. We need to start somewhere where we can iterate. And so we broke it down into three key use cases or three key objectives. And the first is a seamless experience for the user that can be both standalone and, more importantly, back into a workflow within Cerner that they're familiar with or that the hospital is focusing on for their strategy and digital front door. Adoption. Loop is exceptional at getting patients to activate and stay on care plans. And we looked at that with adoption rates and activation rates on portals and in Healthy Life specifically, and this was an area we wanted to target. We thought there was a way to boost adoption and activation across both, and we'll talk about that in a second. And then the last is simplify the workflow for clinicians and providers. And this has such a loaded challenge when it comes to integrations, and we'll talk about where we want to start and where we need help in guiding that process, and where we need validation and where we need to pivot. So the first is that seamless experience back into Healthy Life. And so we're going to come back to our questions from before. The consumer framework, out of curiosity, is anyone in the process of migrating or is currently on the consumer framework? Okay. Okay, great. So this is the future of the patient experience. The Healthy Life consumer framework is really where all roads are leading. And so for Loop, today we support a few integrations into traditional Healthy Life, but where we are moving is functionality that is for that experience, and is a way to help drive not just adoption of that platform, but also adoption of the framework. And so the first step is to actually bring that back in. So patients, we will actually have the workflow option to send patients an activation link to Loop. And upon doing that, we'll be able to check whether or not they have a Healthy Life account. And if they do, we'll be able to decide how we want to route that patient based off of the hospital's preferences. So we'll actually be able to bring them back in from the get-go for patients and say, you're going to experience Loop within the context of Healthy Life. And you'll get the full app, and it'll feel like the full app outside of, on the right-hand side, you'll see maybe you'll have got, some of the familiarity with the framework and navigation to bring you back to other items, but it will be the Loop application. And for the patient, they won't know that any different than if they were to experience that versus the standalone. And so what that will do is help drive them into a platform that maybe they're not familiar with in Loop, and maybe they're not familiar or not utilizing in Healthy Life. And the goal there is to be able to help drive patients back into an area that's also got heavy investment in other resources, bill pay, scheduling, and also where other vendors and other organizations are working to build tools into the consumer framework. And because of that, it will allow us options to make that experience feel more unanimous and feel more like I'm going into my healthcare portal, and I'm not going into a disparate application that is this tied to my provider, is this tied to my hospital? It'll very much from the get-go feel like that one experience. The second is driving adoption. This was a key. This was one of the things when we had conversations that was most intriguing about the success that Loop has had. How can we do that? And part of that is based off of leveraging Loop and its design. The way that it's designed from a product at its core is to be entry level and to be attractable and intuitive, that you say, oh yeah, this makes sense. This is a tone, and the way it's written is in in a way that relates to the provider and his branding and my doctor, that I feel like this is something that I not only should be doing, that I need to be doing. And so from the get-go, we're actually using that to say, hey, by the way, we were able to check and you don't have a Healthy Life account. And we know that there's benefits to having a portal account from the get-go, and prompting, being able to drive the patient there to help get them signed up. And if that happens mid-flight, ways to direct them to that experience in the mid-loop, and say, yeah, you were using Loop in one way, but just because you're experiencing it in the portal, it shouldn't feel so different. That experience couldn't change for you. And then the other side of the equation, what happens for a patient that has a portal account and just hasn't or forgot to activate their Loop? And being able to actually prompt users within the framework who have an account and have a Loop invitation sent to say, hey, you still have this Loop you need to be activated on, and prompt them within another area that they're logging into. And so that twofold, that approach will help drive adoption for both platforms, and also really align with where a lot of organizations are putting time and resources is into a spot that has access in an area that feels more like a hub for a patient and not so many isolated applications. And then the last is simplifying the clinician workflow. So we talked about smart apps from the perspective of inpatient. And let's talk about just a little bit from the perspective of Loop. So this is essentially that same structure of the smart application framework, but in this time we're going to say, I want providers to be able to quickly get into Loop and respond to alerts, to comments, And to be able to do that contextually, either in the context of a patient or more broadly looking at the population as a whole. And so when I'm working in the chart and I want to get into loop and I see something, I say, oh, I've got something that indicated that Jess has got a comment and I need to respond to it. I want to be able to do that quickly and be at that context and be able to close that and get back into the chart and not have to think about, oh, did I log out of that application? Did I have to go down to the taskbar? Is it a favorite? And make that feel like it's part of the workflow. And when there's opportunities to interact, you better believe we don't want to miss them. And I think that's one of the key takeaways that's so different in the loop world, is that oftentimes the percentage and the number of patients that are becoming in an alert status or have a comment or have a need is relatively small. The biggest question is, how do we make sure those aren't being missed? And how do we do that in a quick way that doesn't feel like it's a separate process that's lost, or it's got to be on some tip sheet, or it's on some laminated paper that's taped next to the desk. And when we do that, then we start at a spot where we can really start to test out these new waves, and where Cerner is putting a lot of investment. And more importantly, I think the thing that I want to distinguish is some of these avenues are open to others. And so one of the unique things about our partnership is we've had multiple opportunities to not just work with, but to really be guided by our Cerner colleagues to help us build and think about these in the best way possible. They've brought in teams of people who specialize top down to say, hey, we can see a lot of people on our developer marketplace who are building apps. Let us make sure we help you learn from some of the things that we've learned across the way to make sure that we're not, that we're really approaching it in the best way possible, and that a GetWell app really does reflect that partnership and not just another app within their marketplace, but something that they're also invested in the success and want to see it be embraced as part of that ecosystem. And then lastly, just tying it all together. So how does this work practically? So I think this is where the story comes in. And so one of the ways that we can do this is a use case of a patient coming in, being introduced to inpatient within the hospital four walls. And during that process, we're actually prompting them to capture the most up-to-date information about contact information or email. And then as they leave inpatient and are getting discharged, we're already prompting them and getting them onto a discharge loop. And so that process feels like, before I've ever left the hospital, I'm being empowered with this other tool that says, hey, we're going to be leaving you physically, but we're still going to be by your side and providing with some instructions, whether that's access to your inpatient videos in a way that's, a time, maybe it's more manageable or less stressful to go back and review, or when something comes up and you say, ooh, this was one of those side effects I talked about, I can't remember what the recommendation was, I still have access to that content. Or a more targeted actual loop for a specific care plan based off of a condition or a procedure or a diagnosis that checks in and makes sure things are going well. And if that's simply brand loyalty and making sure that they know that you're getting the best care, and if you have questions to call, sometimes that alone changes the experience of, yeah, I went in for a kind of transactional visit for a health system I wasn't planning on, but the experience was so good that I felt like when I left, they really cared about the outcome in so much that they are connecting with me and wanting me to make sure that that's valued. And I think that's where patients resonate. They want to feel like that doesn't stop because now I've left, and then the next interaction is me fighting with my insurance company and the bill to negotiate what I actually have to pay on the portal that I've never logged into because it's so separated. And I think a lot of those questions are really the ones that have been really fun to tackle with the team at Cerner that I can say are equally invested to making sure that we're successful. And that kind of confidence really changes the perspective for us and our ability to go out there and I think execute on some of these things this year.
Great, so we've touched on a handful of things that we are both doing today as well as things that are in process today. But that's just the tip of the iceberg. There's actually a lot more planned around taking all of those things that we kind of showed that are in place today through HL7 and transitioning those into being API-based. And so we talked a little bit about education and how that actually moves into potentially a smart app that under the covers is dynamically querying Millennium for the information it needs to be making smart recommendations around education. But it also goes a step further. And so that can extend to the medication education of being able to automatically query and know what medications the patient's active medication list is, rather than having to receive a feed, rather than, who's doing medication education today? How painful are formulary updates, right? We could eliminate those completely. right? And so kind of all of these touch points and transitioning over to being things that are a bit more out of the box and are done at a software level as opposed to an HL7 message feed level actually really kind of accelerates the opportunity for us to go live with capabilities and really start to have patients feel the value much faster. Questions? Go ahead, Joe.
That's great. Well, first off, Cheryl, thank you for sharing your very personal story. That drives passion for all of us, so thank you. I see a lot of purple in the room, so this is more of a comment for the GetWell team than a question. But as Bay State Health went on its journey of selection of GetWell, it was a very detailed process. And as we began to learn about this consumer framework, it really laid into our strategy of our Cerner EMR strategy and what we're doing for our population. And then when you acquired HealthLoop, it made more sense. And at the end of the day, the president of our hospital has basically called our team a genius for putting this together. So thank you for letting us be a genius. So,
Thank you.
So that's all good. But also on the Cerner side, David Bradshaw coming over from Memorial Hermann, the focus that they have on this strategy, for the Cerner sites, it makes perfect sense. So we're looking forward to the journey. We just started with our implementation, as you know, in our inpatient unit, hospital, about 800 beds, and then going to our community hospital, then plan on adding loop and everything else. So that's just more of a comment for the GetWell team. We're excited as customers, as partners, to head down this journey with everybody. So again, great presentation by both of you, and thank you so much.
Thank you very much, Joe. Appreciate your comments. We're sorry that we couldn't say greater things. I know Brian said this a lot about kind of the partnership that we've gotten from the folks at Cerner and just their openness and willingness to think about things differently sometimes too.
Yes, thank you for that information. So the VA, as you know, is going to Cerner in 2 years. 2 years. So that's kind of an inside VA joke. But anyway.
Right.
The health portal for veterans is My Healthy Vet. And you're mentioning something about Healthy Life. And so that sounds kind of like a health portal, so I'm confused. Is it going to link to My Healthy Vet?
That is a good question. I don't know the answer to that. So Healthy Life is actually Cerner's solution for their portal. Like this is the portal that they are bringing. I don't know the detail. I know I'm familiar with My Healthy Vet. I'm not sure what the intent is within the VA. Melissa, do you know the answer to that one?
I'm coming.
So actually, if you saw the OIG's report that came out today, that's actually the reason for the delay at the IOCs, is the link between Cerner and My Healthy Vet, and then not being able to order their prescriptions through the patient portal, which is what they use. So I think that's still in the works, but it's in the plan in what they call the capability set phases.
So My Healthy Vet is a different solution than Healthy Life from Cerner.
And My Healthy Vet's not going anywhere.
Nope. Anything else? Anybody?
Back there.
How you doing? So I guess my question is, are you using your own content, or are you using any of the contents from some of the people or some of the vendors that Cerner already has in place? Like your HealthWise, your Staywell, your Elsevier. So I noted that I think you have some sort of an agreement with Elsevier, from what I understand, or
Yes,
from the Elsevier rep.
The answer is yes. We use vendor from all of those folks, and one of the things that we have our approaches have been that we are a delivery tool. Now, as kind of we've matured and we've identified areas where we're finding gaps. We have actually invested in content creation, either through partnerships with other folks or with some of our customers. Kids Health is kind of a notable investment that, there was a dearth of pediatric content available. And so we worked with them to actually create a whole bunch of content there. And some similar things on the Loop side where we actually are creating a lot of that content ourselves, but embedding content from other vendors and areas as well.
So in order to keep us all on track, I just want to thank everybody. Please come and join us for closing remarks in the Regent Ballroom.